Ouch, ouch, my back hurts. Welcome back, it's Drsaru. I hope you've been keeping well. So for today's topic, a commonly asked problem. Did you know it's the third leading cause of disability in the United States? I didn't get the statistics for our country, but you can imagine how much it is a burden. Like everyone anaumwa tu na mgongo. Like surely guys, we have to talk about this thing. Like why? What happens? What causes the back pains and how it's brought about, and how can we manage back problems? Welcome and join me as we're going to demystify all these things. So guys, there's so many causes of lower back pain. I'm not going to speak about all of them, but I'm going to talk about the most common causes of lower back pain. I like to summarize it in posture and position. I'll go into depth to explain what posture and position means, but let's look at other causes of lower back pain, which I'm not going to go deeper into. Okay, posture and position. Now, trauma. You can be umepata accident, kwa mfano ukagongwa, kulikuwa na impact, labda gari imewagonga kutoka kwa nyuma, kwa hivyo ukagongwa na gari ikagongwa na nyuma, kwa hivyo mgongo ukaabsorb hiyo shock. Kwa hiyo you get a back pain secondary to that trauma. You can have fallen from a height. Is it a tree? Is it maybe you're climbing a stair and then you fell down? That also is classified under trauma. So that one is self-explanatory. Of course, it's different when it's trauma. Even managing it will be different. But I'm talking about this chronic long back pain for a long period of time that you've been having back pain. The other thing other than trauma, there is nerve compression. Now that one I'm not going to touch about it. That one you need to have to go to your doctor after umefanyiwa a series of several tests and imaging. They realize it's nerve compression. They'll explain to you what they can do and what is management, that the right management that they're going to do for you. My favorite thing that I always tell pregnant women: pregnancy is like one of the first things of the first common causes of lower back pain, especially for reproductive women. So you can either be pregnant at that particular time, you get the back pain, or you can have gone through childbirth and get the back pain. So not necessarily that you got the back pain because you're pregnant. Of course, because of the load. I'll explain this. Even for people who are obese or they have truncal obesity, that is the fat that is just around the abdominal area, they get serious and terrible back pains. And it's because of the fact that your spine your spine feels as if it has so much weight to bear, and it's still the same. Your spine has not grown or gone anywhere. It's still the same narrow thing, and here you are adding upon weight and you're expecting it to be able to bear that weight. So for pregnancy, yes. Childbearing also. And then we've already covered now the fifth thing, which is the obesity or weight gain. Also, I checked, there's some incidences where hormonal imbalance, especially with menopause or postmenopausal women, where they get back pains. Now, it's not necessarily because of also the hormonal imbalance that postmenopausal women get back pains, but it's because of when you're in menopause, you tend to have less calcium. So because of that less calcium, sometimes it can also cause low back pains. The other thing is bulging disc, of course, spasms in case of sports. Maybe you engage in sports or sporting activities such as rugby, or maybe you're somebody who does heavy lifting in the gym and you end up getting muscle spasm of the back, and again it causes you to have back pains. The other thing that I know people are going to bash me in the comment section is wearing heels. Again, wearing heels can cause you to have back pain, considering you're not at a very stable position. You see, even, and especially if you're using your heels to walk for a long distance a long distance or a long period of time, you're going to definitely get back pains because you're straining your back while you're trying to balance on those heels. So let's go back to number 1, posture and position. You see, today I'm trying to sit very upright so that I can be able to explain to you guys how exactly somebody's supposed to be. Our spine, yes, is not straight like this. It's curved, yeah? And because of that, you don't need to like sit completely upright like this, because it might also hurt your back. But there's a way that you just feel how you're supposed to sit into your spine. The problem that we do, most of us, when we are at the office, you're busy trying to maybe check your phone or check your book. You're like this all the time. You're slouching. You get, so when you're slouching like that, definitely you're going to strain your back. That is part of position and posture. The other thing, when we get to bed, and the positioning of how you sleep also matters. And part of still, which I like to put it on the position and posture, is your mattress. How frequent do you happen to change your mattress, for example? Because most people complain that they have back pains, but oh well, the mattress is since the time they left school, like the last time they changed their mattress. So now that we have known some of the major causes of what is it called, back pain, another thing just to overemphasize on position: if you're doing exercises or just started on exercising and you don't know a proper form, that is part of position. So you can hurt your back trying to do deadlifts and you're busy not putting your back straight. So you're trying to prove to everyone that, oh, I just came into the gym and I'm killing it. And you're busy hurting yourself other than making yourself better. And you're going to end up thinking, oh, if I do it next time, if I do it the following day, my back is going to get better. But no, you're going to hurt it even more if you don't practice the correct form or correct posture or position. So now that we found out the causes, you might ask yourself, you're not going to tell us how we can help this thing? You've already told us pregnancy, so okay, fine. I know when the pregnancy is done, or if I lose weight because it was because of being overweight that is causing my back problems, it's going to disappear. Yes, exactly. So treatment is based on the cause. For example, you're pregnant because you're having back pains because you're pregnant. So definitely, if you give birth, we're assuming when the load is off, it's going to start slowly going back. You can always talk to your gyna so that she can recommend whatever therapy that she'll see suit. If she needs you to go for a few sessions of physiotherapy, if she thinks you need to do a few sessions of whatever it is, if she also thinks you just need a masseuse and that will do the trick, she or he will be able to direct you from that point. Now, weight loss, again, it helps. The other thing also, I told you, not exercising or doing exercises in the wrong form can cause back pains. So definitely, if you do the correct posture now, you're going to get better with your back pain. And if you're not exercising before, you've been lying around like a couch potato, you're going to also feel better if you start working out and you lose some of that gut, that trunk on obesity, try and cut it down. You're definitely going to feel better and you're going to look good also. The other things that you can do, you heard me talk about a mattress. I tell this to all my clients. Please, if you've never changed your mattress, go for the right mattress. Because you spend a third of your life. If you actually spend 8 hours in bed, 8 out of 24 hours, that is a third of your day in the bed, and you're not getting a proper rest. So the best thing to do, check the mattress. And I don't recommend this high density, the ones that look like firm, stonish, I don't know, like a hard surface kind of mattress. Discuss with your therapist, if he's a physiotherapist, or even when you go to buy your mattress, you can discuss with the person who is selling those mattresses to be able to hook you up with the right one. Because as I told you before, our spine is not as straight like a stick. So if you expect that you're sleeping on a hard surface and you expect that your spine is going to be taking nice form and you're not going to have any muscle spasms or any problem in your back, then you're lying to yourself. Some people have had a problem with back pains, especially upper back pain, with using the wrong pillow, or not using a pillow, or using a pillow. So depending on what your issues are, you can decide on either you're going to choose the right pillow, or if the pillow makes your head hurt or maybe your neck hurt, you can decide to also choose the right pillow. I'm not going to endorse any pillows in this forum today because nobody paid me for that. But there are several pillows that people have actually attested that they do really well and they change your life. You have better sleep, better quality of your day, because now you feel like you're refreshed and you actually had a great day. Of course, if it's muscle spasm because of poor position or maybe some sport, analgesics are good. You can just get some painkillers and a muscle relaxant, or maybe something topical also to apply, as well as the one that you're going to swallow, and that can help your situation and elevate your pain. The other thing that I forgot to mention is sometimes for back pain, also there's some mental illnesses that have been linked to back pain, such as anxiety and depression. That's why I said it's best when you have an issue like that, like you have a back pain, don't just immediately take yourself to a physiotherapist or immediately take yourself to a masseuse, because those are some of the things that can help, yes, but unless a doctor has identified what is the actual cause of your problem, then it can be a problem for you trying to solve it yourself without knowing what the actual cause is. So you have to first visit your doctor. They'll identify if it's just because of muscle spasm, is it because of a poor posture or poor positioning, is it because when a doctor takes a proper history, they can be able to tell you this is because of infection, if there's something that is causing it, because even cancer or some tumors which are not malignant can also be compressing on your nerves at the back, or even at the spine, or whichever place in your back that might be causing you to have those pains. So please, before you do anything like seeking your own medical attention, just seek a doctor's opinion first. Let them examine you, let them take history from you so that they can be able to understand what exactly could have been the issue. Because you can also just have a fall which you think is minor, and you take painkillers at home, and maybe you had a fracture and you don't know, and the pain keeps being chronic and you continue having pain, and you're taking yourself medicating at home and you don't know if you had another issue that is developing. So it's best that you first see your doctor. They identify the cause of your back pain, and then now they treat it according to the cause. But as you've seen, most of these things are things that we can do on our own. If you never had problems with your back and then now you just realize, oh, I'm pregnant and I'm having a back pain, just know it's because of the pregnancy, but still, talk to your gynae. Until next time, it's Dr. Saru. Love and love.